Hi, you guys. Welcome back for our daily practice questions. It is day 174 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it's free and linked in the description. My website is also linked in the description with all resources that I offer. All right, you guys, question number one states a 45-year-old presents with pain over the lateral elbow, worsened by wrist extension against resistance. What is the best initial treatment? Is it A, corticosteroid injections? Is it B, a elbow brace, NSAIDs, and activity modification? Is it C, a surgical tendon release? Or is it D, immobilization with a long arm cast? Take a moment and tell me what you got. All right. I always recommend reading the stem of the question first. Stem of the question here states, what is the best initial treatment? Now, I always tell y'all, if they're looking for a treatment, run it back and see if they gave you a diagnosis. If they have not, you have to run it back a step further and look at those assessment findings so that you're able to determine what it is, because we have to know what it is to be able to treat it. So there's no diagnosis provided, so we're checking out our assessment findings. We have a 45-year-old who presents they have pain over their lateral elbow and is worsened by wrist extension against resistance. Now, the key here is that lateral elbow. This right here is classic for lateral epicondylitis. Remember, lateral epicondylitis is also known as tennis elbow. And I always say, think about lateral has a T in it, whereas medial does not, right? So think tennis elbow with lateral epicondylitis. So then you need to think, how do I treat initially for lateral epicondylitis? And your best answer is B. You want to utilize the elbow brace, provide NSAIDs, and then activity modification, okay? All right, question number two. A 38-year-old complains of pain on the inside of her elbow, radiating down the forearm, and is worsened by wrist flexion and forearm pronation. What is the best initial therapy? Is it A, oral corticosteroids and elbow splint? Is it B, activity modification, NSAIDs, and physical therapy? Is it C, elbow casting? Or is it D, an ulnar nerve decompression? Take a moment and tell me what you got, y'all. So, stem of the question here states, what is the best initial therapy? Again, they're looking for a treatment. Do we see a diagnosis provided? No. So, run it back and look and see what the assessment shows you. Remember, assessment, signs, symptoms, presentation, right? So, this 38-year-old comes in complaining of pain on the inside of the elbow, and it's radiating down the forearm, and it's worsened by wrist flexion and forearm pronation. So, this is opposite from question one. So it's the inside of the elbow, medial, not lateral, and it's worsened by flexion, not extension. So this is medial epicondylitis, right? It's your golfer's elbow. So your best answer is B. You want to do activity modification, NSAIDs, and physical therapy. All right, lastly, question number three. A patient with lateral epicondylitis has failed 3 months of conservative therapy. What is the next best treatment option? Is it A, start oral prednisone? Is it B, surgery? Oh, Lord, sorry. I should say B, refer for corticosteroid injection. C, begin opioid therapy. or D, MRI and immediate surgical consultation? So let's read these answer choices again because clearly I tried to give y'all several choices for B. So A is to start oral prednisone. B is to refer for corticosteroid injection. C, begin opioid therapy. Or D, MRI and immediate surgical consultation. Take a moment and tell me what you got. So stem of the question states, what is the next best treatment option? So again, when it says next best, this lets you know that there's some type of treatment that has already been in place. So typically when it's like that, they have provided you with a diagnosis because they're asking you the next best, right? So we have lateral epicondylitis. They have failed 3 months of conservative therapy. So conservative therapy is what we're doing in question one, right? Adjusting their activities, so that rest, giving them NSAIDs, um, elbow braces, all of the things, right? So when that has failed, you then want to refer them for the corticosteroid injections. You can now do the injections after you have tried the conservative approach. And remember, first line with most musculoskeletal injuries, we want to rest the area. We want to provide NSAIDs to reduce that inflammation. And if splinting or bracing is warranted for that particular location, we're most commonly going to do that as well. So when in doubt, look for those choices because that's the first thing you want to do, right? All right, you guys. As always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. But as mentioned previously, my website is also linked in the description of this video that takes you to all of the resources that I offer. And it's broken down for first-time test takers and those who may be retesting so you know what is best for your scenario. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.